What if I told you you could ease your knee pain just by changing the way you walk? No surgery, no pills, just a small tweak to your steps. Knee osteoarthritis is a painful condition that happens when the cushion between your knee bones, the cartilage, wears down. For millions of people, every step can hurt. But scientists from NYU, the University of Utah, and Stanford found something amazing. Changing the angle of your feet just a few degrees can reduce stress on your knee, relieve pain, and even slow the damage. In their study, they tested 68 people with knee osteoarthritis. First, they measured how each person walked. Then, they figured out the perfect foot angle for every individual, sometimes a little inward, sometimes a little outward. After a year, those who changed their foot angle had less pain, about 2.5 points lower on a 10-point scale, similar to over-the-counter pain medicine, and their knee cartilage broke down more slowly. This technique is simple, inexpensive, and has no side effects. One small change could mean more pain-free walks and maybe even avoiding surgery. So next time you're out for a stroll, remember sometimes the smallest steps make the biggest difference for your health.